Hello, Kent County. I'm Dr. Adam London, Director of the Kent County Health Department. I have good and bad news to share in this update. The bad news is that our region has yet to break this fall wave of COVID cases. The data that I pulled from our data dashboard on November 4th at 9:25 shows that we are averaging 303 new diagnosed cases each day. This pace of new cases has remained in that general ballpark for about a month now. The data also show that there are 226 COVID positive cases hospitalized here in Kent County. 60 of those people are in intensive care. There are 7 COVID positive children hospitalized at the Children's Hospital. Thankfully, none of them are currently reported as in intensive care. At least 915 Kent County residents have died from COVID-19. Earlier this week, the Kent County Sheriff's Office announced the passing of Deputy Dave Cook from complications of COVID-19. Sadly, this is part of our nation's experience with COVID-19, which is currently the leading cause of death for law enforcement officers. The thoughts, prayers, and condolences of all of us here at the Kent County Health Department go out to the Cook family, to our brothers and sisters in public service at the Sheriff's Office, and also to all of you who have lost a loved one during this pandemic. Now for the good news. The FDA and the CDC have authorized and recommended the Pfizer vaccine for children between the ages of 5 and 11. The federal reviewers concluded the vaccine is almost 91% effective at preventing symptomatic illness, and there were no serious side effects observed in over 3,000 children included in the study. I've said it many times, vaccines are among the most intensely studied products in modern society, and their track record of limiting devastating diseases and only having very rare significant side effects is unmatched. As many of you know, I have a daughter in this 5 to 11-year-old age bracket. My wife and I, we're super excited to protect her with vaccine, and we are 100% confident that she'll be better off because of it. To the parents out there, I hope you share our enthusiasm, our commitment to public health, and our deep desire to end this pandemic. Thankfully, we have vaccine providers throughout the nation who are beginning to make the Pfizer vaccine available to those children right now. Here in Kent County, we're blessed with a strong network of vaccine providers, and Kent County residents have some of the highest vaccine coverage rates against infectious disease anywhere in Michigan. Many of our pharmacies and our pediatric offices have or will very soon have the vaccine available for children. Here at the Kent County Health Department, we are currently taking appointments for this age group. Appointments can be made for all 3 of our clinic locations by calling 616-632-7200. Now, I expect that most vaccine providers will see a large surge in demand over the next couple of weeks. Please be patient. As a network of vaccine providers, we will make sure that families have access to the vaccine in a very timely manner. So, many people want to know what all this means for the public health order that I issued, which requires mask use in the pre-K through 6th grade. That order was written to expire 60 days after vaccine is made available for 5 to 11-year-olds. This means the order will expire during the Christmas and New Year holiday break and before kids return to school in Kent County on January 3rd. At that time, decisions about facial covering policies will fall to the school districts and to the leadership of the private and parochial schools. If they decline to adopt such policies, the decision will belong to parents and the students. While community transmission levels remain high, the CDC recommends that all persons in the school environment should wear a facial covering regardless of vaccine status. The Kent County Health Department shares that recommendation now, and we will continue to recommend that practice after the order expires as well. It is my great desire to move away from orders, and it has always been my priority to see our schools full and our hospitals not full. To that end, you can always count on this health department to make recommendations which protect public health. And according to the CDC, and according to data that we have from the University of Michigan and the Michigan Department of Health and Human Services, The reality is that facial covering policies in schools correlate very strongly with lower rates of illness and fewer outbreaks. While our order will expire before school resumes in January, our recommendations remain the same. And these include wearing a facial covering in schools and in other indoor crowded places, staying home and getting tested if you are sick, isolating yourself if you have COVID-19, and most importantly, getting vaccinated against COVID-19. Thank you for all that you do to make Kent County a healthier place, and I'll talk to you again very soon.